From the PEP Radio Newsroom, this is the Hourly News Blast. LGBTQ Nation is reporting that the Department of Justice has demanded private info on trans youth patients from 20 gender-affirming medical providers. The Department of Justice has issued subpoenas to medical providers who offer gender-affirming care to transgender youth, demanding that they provide information on their young patients. The subpoenas demand billing documents, communication with drug manufacturers, patients' social security numbers, addresses, emails, Zoom recordings, voicemails, encrypted text messages, as well as every writing or record of whatever type doctors have made from January 2020 to the current day, according to the Washington Post. While Attorney General Pam Bondi admitted last month to sending 20 subpoenas to hold medical professionals and organizations that mutilated children in the service of a warped ideology accountable, she didn't specify which organizations and individuals received the subpoenas. Anonymous informants told the aforementioned publication that some of the subpoena recipients who got the subpoenas in June operate in states with laws protecting gender-affirming care for youth. One trans civil rights activist called the incident an unprecedented and disgusting violation of medical privacy. The government is using its investigative powers to target medical providers based on a disagreement about medical treatment rather than violations of the law. Jacob T. Elberg, a former federal prosecutor specializing in healthcare fraud, told the Washington Post. He added that the Department of Justice must show that the information it demanded is relevant to a legitimate law enforcement probe. The publication contacted numerous clinics and professionals offering gender-affirming care for youth, but none would say whether they had received a subpoena, citing fears of violent threats or government retaliation. Other hospitals have been closing their trans youth clinics and erasing any mention of gender-affirming care from their web pages to avoid federal threats to cut funding or pursue prosecutorial charges. The subpoena is a breathtakingly invasive government overreach, said Jennifer L. Levy, Senior Director of Transgender and Queer Rights at the LGBTQ+ legal advocacy group GLAD Law. It's specifically and strategically designed to intimidate healthcare providers and healthcare institutions into abandoning their patients. Fewer than 3,000 teens nationwide receive puberty blockers or hormone replacement therapy, according to a 2025 Journal of the American Medical Association analysis of private insurance data, the Post noted. Responding to the news, transgender civil rights lawyer Alejandra Caraballo wrote via Blue Sky, "This is an unprecedented and disgusting violation of medical privacy," adding, "The fact that no lawsuit has been commenced challenging these subpoenas in court is ominous. My best guess is that many of the providers have complied, and now the Department of Justice is potentially sitting on the records of thousands of trans youth, covering everything from therapy notes to pre- and post-op photos." Though there is no federal law banning gender-affirming care, the current presidential administration has sought to eradicate the practice through a January executive order that has since been blocked by several courts. The order instructed the DOJ to extend the time that patients and parents can sue gender-affirming doctors and to use laws against false advertising to prosecute any entity that may be misleading the public about the long-term effects of gender-affirming care. In April, Bondi issued a memo to Department of Justice employees telling them to investigate and prosecute cases of minors accessing gender-affirming care as female genital mutilation, even though hospitals don't conduct such female genital surgeries. The memo threatened to jail doctors for 10 years if they provide gender-affirming care to young people. Gender-affirming care is supported by all major medical associations in the United States, including the American Medical Association, the Endocrine Society, and the American Academy of Pediatrics as safe and life-saving for young people with gender dysphoria. Apparently, Pam Bondi doesn't understand a goddamn thing about medical science. Which brings us to our final thoughts. One doctor interviewed by the Washington Post called the federal government's crusade against gender-affirming care a toxic plan that will force some patients to detransition, potentially forcing them into adverse psychological and physical effects, including increased anxiety, depression, and the development of unwanted physical changes. This goes way beyond any degree of moral or ethical dilemma that any of us have ever experienced, the doctor said. It is completely scientifically and medically unfounded. Republican attorneys general in Texas and Tennessee have demanded similar patient information from providers of youth-centered gender-affirming care outside of their states, but they dropped their lawsuit demands after courts blocked their efforts. That's News Blast at this hour. PEP Radio is now available on Roku, the PEP Radio page at paequality.com, the Live 365 app, and on Alexa. Simply tell your device, Alexa, play PEP Radio. If you are watching our news videos on YouTube, please subscribe to our channel and let us know what you think of the new video format. Up next, we have the Meadville area weather forecast here on PEP Radio.